2, 3.
So this video submission is about sterile asepsis with gloves. So now I'm going to gather the doctor's order and review it and gather the information of the patient. The patient's information is Sid Garland, MRN number 344316, allergies, penicillin and codeine, and the birthday is November 8, 1965. So now I'm going to look at the doctor's order, which is cleansing the wound with normal saline, apply dressing to wound, and change dressing every 3 days. So that's the doctor's order. So now that I gather and review the doctor's order, I'm now going to do hand hygiene and collect all the equipment that I needed for wound dressing. So I have clean gloves, 2x2, 4x4 gauze, abdominal pad, sterile dressing, sterile gloves, a sterile kit, and the normal saline, and I also have the tape to secure the wound. So I just gonna place my kit over here. Okay, so now I'm gonna do hand hygiene, and I'm going to introduce myself to the patient in his room. Hi, my name is Annabelle. I'm a student nurse from Durham College, and I'm here to change your wound dressing. Is that okay?
Okay.
Could you please state your first name and last name, please?
Sid Garland.
Sid Garland, and your date of birth?
It's November 8, 1965.
Your allergies?
It's penicillin and codeine.
And your MRN number is 344316. Thank you so much.
You're welcome.
So before anything, I would like to ask you if you're in pain.
Not at this moment, not so much.
From a scale of 0 to 10, how would you rate your pain?
2.
2? Oh, that's not bad at all. So would you like to go to the washroom before we start the procedure?
Not at this moment. I'm good.
So you're comfortable?
Yes.
Thank you. So I just gonna do a environmental check.
Go ahead.
Okay, to make sure everything is okay. So I just start with your oxygen, your suction, and your air. See if it's working, and I want to make sure that your lighting in your room is okay. And I will have to close the drapes for privacy. And in this side of the rail, I just have to lift it up so for your safety, and I just have to raise the bed up for my working height, and I have to check the bed breaks, make sure it's on, 4 corners, and I want to make sure that your floor has no clutter. And now I'm going to just close your wound, your abdominal area, and I'm just gonna adjust you for comfort, so that you are comfortable when I'm doing the wound dressing. Okay, so now I'm just gonna do hand hygiene again. Now I'm ready to open my sterile film. Make sure this tray is not expired. So this is garbage. I'm just gonna put it here, okay? So now I'm just gonna open my sterile tray. I maintain a 1-inch border, and I'm just gonna grab the forceps and adjust my sterile field, and I'm just gonna grab my my garbage on this side. And now we're just gonna fix this area, make sure I maintain a 1-inch border. It's going back. Now I'm just gonna remove put it here, my drape, and some of my gauzes in here. And there you go. So now I'm just gonna start opening my garbage. Okay, so I'm just gonna start opening my gauzes. I start with 2x2. It's garbage. And 4x4. And garbage. And the last one is my ABD pad. Now it's garbage. I make sure that all the gauzes are not expired. And now I'm going to check my normal saline. It's not expired. 12/21 is okay. So I just gonna throw some in my garbage for sterility. And now I'm going to pour some in my sterile tray. Okay. So now I'm ready to put on my clean gloves to remove the outer dressing. Okay, now my clean gloves are on. So I'm just gonna expose your abdominal area to make sure your wound is I can see. Now I'm removing the outer dressing. Now this is garbage, and my gloves is garbage. So now I'm going to grab the forceps to remove the inner dressing. So I see that the dressing is contains pale red watery, contains serous and sanguinous. So now this is garbage. Now my forceps is also garbage. So now I'm ready to I'm just gonna put this one over here on this side, and I'm ready to put on my sterile gloves. So my sterile gloves. I maintain 1-inch border at this point. And the second one. So now I have the sterile gloves. Now I'm ready to grab my drapes without contaminating the gloves. So now I'm ready to to clean the wound. So now I'm going to grab my forceps. So this is middle, top to bottom, garbage, and this is going to be distal. Distal, garbage, nakikita yun. And this is proximal, and it's garbage. So now I'm ready to dry the wound. Top to bottom, middle, garbage, and this is distal, garbage, proximal, garbage. Now my forceps will be going to go to the garbage, and it's going to the biohazard container. So now I'm ready to assess the wound. So at this point, the edges of the wound are well approximated, and it's healing by primary intention, and the sutures are intact. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and it's complete. So now I'm ready to grab my 4x4 dressing to cover the wound. So this is 4x4 dressing. And one more. Another 4x4. Okay, now I'm going to grab my abdominal pad. Okay, now I'm going to grab the tape to secure the wound. Okay, so now I cover the wound, and all the sharps are going to biohazard container, and all the garbage is going to the disposal to be disposed. So I'm going to remove my sterile gloves. And now I finish the wound dressing. Now I'm going to cover my client. so he can be comfortable. So now I'm going to do hand hygiene, and now I'm going to ready for documentation, and I will document the time and date and what gauzes I place at this point, and the assessment that I did. So that concludes my sterile asepsis with gloves. Thank you.